Hi there, my name is Amanda SAFFER. I am a functional medicine consultant for Zymogen and also a board certified health and wellness coach.
I'm Dr. Bruce Sadlick, and we're going to be talking today about a couple of different things: men's health and women's health and allergies. So we're going to be going through a couple things for men's health that could be very beneficial in terms of utilization. We'll try to hit it from both aspects, going kind of upstream with men's health, and then obviously things that help once we get to where we're going. So Amanda, I'll have you kind of start with, maybe we'll go low stream and look for, we'll talk about the BERGACOR Plus.
Yes.
And then with ED and then hyperlipidemia, and just I'll chime in as we need to.
Great, yes. So, basic for, our cardiovascular health, there's this product, it's called Bergamot Plus. And what it is the bergamot citrus from the boot of Italy, and it's the amla berry from India. So it has an Ayurvedic kind of synergy to it. And the incredible thing about this product is it controls blood pressure, but it also decreases LDL, triglycerides, it increases HDL, it increases nitric oxide, which is very important, for cardiovascular health, of course. And then it also increases glutathione, which is our master antioxidant of our body. So it comes in a tablet form, which is easy to take, or you can break it in half. To take it, but it takes about 2 months for it to start working if you wanted to look at blood report results. But it's been very successful. There are studies that compare it to Crestor, the statin, for lowering lipids and increasing HDL. And then also the incredible benefits it has, again, for increasing glutathione and nitric oxide.
So remember, if there's ED, erectile dysfunction, or issues with men's health, always kind of look at what could be the causational factors. Yes, there are a lot of OTC products that can be helpful, but you need to kind of go back to the core. So look for finite things, such as varicosities in the legs, such as a history of cardiovascular disease in the family. You want to rule out some of the obvious, work from that base, and then go up from there. We're going to hit real quick Testo Plus, which is another item that may be very helpful for men's health in general and erectile dysfunction.
So Testo Plus is basically a product that will help with increasing testosterone levels, supporting healthy testosterone levels, libido, and then vitality as well. It optimizes physical strength and endurance, and it also supports cognition, which everyone needs once they get to a certain age.
And then the prostate health itself, let's talk a little bit about the ProstaFlow and just basically some of the benefits to maintaining. Obviously, check your PSA, get that done.
Yes.
I like checking that at least yearly. If you have had a slight blip in numbers, I always like to recheck it. But we'll hit real quickly ProstaFlow and its benefits.
So Prostate Flow by Zymogen supports healthy prostate levels. It supports healthy lower urinary tract function in men, normal urinary flow. It kind of keeps that inflammation low. It supports nocturnal frequency. So if you're waking up in the middle of the night, that exhausts you for the rest of the day. So it kind of helps balance that out as well. And then it supports healthy prostate-related hormone metabolism as well.
So remember, if you feel as though you're not voiding completely and that you still have what we would call residual volume, try OTC. If not, come in, we can talk about it and pursue testing as needed.
Yeah. And the nice thing about a lot of these products, that they're all just natural compounds found in nature. Side effects are very, very low, if any. And then they can also work in synergy with any other pharmaceuticals that you may be on as well. So you could definitely talk to your doctor about, okay, I think I do need this after listening to this. Oh, I need some more support here, because there's that perfect combination for you. You just have to talk with your doctor about what it might be.
Thank you, Amanda.
Mm-hmm.
Obviously, we have women's health, so we're going to hit that real quick. Women's health, PMS, hot flashes, a lot of different ways to go about it. First of all, you can find out if you're getting more towards that perimenopausal, menopausal phase. Laboratory serologies are good. FSH, LH, and there are a lot of other hormones. Look at estrogen, progesterone. See if you're approaching that phase. And you may go into PMS earlier than other in your family did. A lot of it is environmental. There's a certain amount of toxicity and plastics that are available, and unfortunately that do cause sometimes early onset of PMS. PMS can be quite disruptive in lifestyle, as we were talking before we went on air. So give me a little bit of feedback on the PMS products that you offer and how they might give some a little bit better sleep at night.
Absolutely. So this is one of the top sellers for female health within Zymogen. It's called FemQuil. And what it does is supports a very balance of the female hormone cycle. It actually eases symptoms of PMS, but also of menopause. And that's thanks to a product called a compound called Vitex. It's a chasteberry. So if you had bad cramps with PMS or issues with menopause, that's what actually helps regulate that as well. It promotes estrogen detoxification and then antioxidant support and cellular support because it has really nice vitamin B's in it, some magnesium, just things to keep your body just kind of stable and supportive of your body. We had a patient, one of the greatest success stories I've heard with FemQuil. She was having horrible hot flashes at night, and it was more like sweating through the sheets, waking up, just feeling miserable, not herself, very unhappy. So we talked to the doctor, and they said, when you have the worst symptoms during the day, you take it a little bit before that. So, just to be aware of okay, my symptoms are horrible at night. I know this, I have hot flashes or, cramping, whatever it is. So she would take 2 of these in the morning, 2 FemQuil in the morning. And then she took 2 FemQuil before bed. And she said it was the first time that she has woken up in many, many months without sweating through the sheets. So I thought that was a very good success story. And she said that she was so happy, she slept so much better, and that her family was so much happier and her mood that they wanted to write a thank you note. So I thought that was a little bit of comedy in all of this. But, they do use this in women with PMS for cramps as well. So it can support a wide range of things. Again, natural compounds that, just support overall health.
And remember, if you are losing that valuable REM sleep, whether it's from BPH or i.e. hot flashes, men and women, you lose that REM sleep, it's going to cause more immune dysfunction, and it's just going to make the next day extremely difficult to deal with. So always kind of look at what's some of the causational factors. Yes, you may have insomnia. Yes, we can treat that with medications or botanicals, but then let's dig a little bit deeper and see what could possibly be causing that.
Right. And it's just about getting to, the core of the issue, starting at the core issues and then, healing that and finding the right combination of what products you need to be on for that. So, that's all it is. And it can be very simple once, Dr. Sadlick has a whole history on you, then he will know exactly how to be able to work with you on that. But this is very, very, I'm on this personally, and it's been absolutely wonderful for me and regulation and just for overall mood. It has magnesium, so it kind of keeps your body and mind just kind of calm, cognition high. So it's been a great compound.
While I've got you to visit us, let's hit something that seasonally has been affecting everybody that has any type of allergies. Remember, allergies, there's a kind of a combination approach. You can find out what you're allergic to. Testing's available. Give us a call here. And then in the interim, though, see if you can buffer down the symptoms. So we're going to kind of hit it from a multi-faceted approach. One will be the GI system and allergies. Obviously, there's food allergies. Now, can you imagine if you have food allergies, say it's carrot, milk, gluten, and you have high reactivity to those, and then we stick you outside, and let's say you have Palo Verde, mesquite tree,
everything that's in bloom right now,
So you got 2 vectors hitting you at once. So the goal here is to try to decrease both of those vectors, if you can knock them down by 30-40%, you have less histamine release, and most likely you can be a lot more comfortable.
Exactly, and that is what, exactly what doctor said is it's the 1-2 punch, because your body is, you're ingesting foods that are high in histamine. Your body cannot break that down, so you're getting these allergy reactions. Not necessarily be a food allergy per se, but your body's just having a hard time breaking down this histamine in food, cheese, meats. Wheats are very hard on people. All our favorite things, wine, beer, those are very high histamine foods. So you feel like, oh my gosh, I'm having this horrible reaction. It's just that your body doesn't have enough of this histamine dioxide to break it down. Diamine oxide to break it down in your gut, if you will. So, as doctor said, so you're, eating these foods that are causing these histamine reactions. So your inflammation's already high, and you're trying to fight off these outdoor allergies when everything is already low inside of you. So the first approach would be to support the healthy degradation of food-derived histamine. There's a product called Histiao, and you would take it right before you eat your meals that are considered high in histamine. There's lovely patient education that the doctor could send you home with. They would tell you more about what exactly is happening, symptoms of histamine intolerance, like we have talked about. A lot of it can be headaches, diarrhea, asthma, histamine intolerance versus food allergy, how to know the difference. And then it talks about, like what I mentioned before, the foods that are rich in histamine, those cheeses, the meats, alcohol, chocolate. And then there's actually foods that liberate histamine. So what you would do is take this Histiao, diamine oxidase, and you'd go on a lower histamine diet. And then what that does is it helps these tight junctures in your stomach heal up, so less of those allergens are flowing out into your bloodstream that causes those kinds of reactions. So this would be kind of the long haul, the heal your gut approach. Your doctor would work with you on probiotics as well, prebiotics, whatever else you needed for gut support. And then for more of the acute allergies, you have this, it's Allerdhq. Do you want to talk on that?
Yeah, Allerdhq is a combination of things. So we know about quercetin. Quercetin's in a lot of the older pharmaceuticals that we used to have, ironically, the cromolyn based. Some of those are still available as inhalers. A lot of those are in Canada.
Wow.
Yeah.
Wow.
They're neat, but the allergy DHQ does have some of the mechanisms to definitely reduce the histamine load.
Yeah.
So bromelain, bioflavonoids, the quercetin we just mentioned, that was really a strong part of the pharmaceutical world back in the 50s and 60s, still available in certain products. So keep that in mind. To try to hit it on a duality of approach.
Yes,
because that will
perfect.
definitely help.
Yes.
And then the bromelain's good as an anti-inflammatory, and it just helps with mucus secretions, etc.
Right, exactly. And then they has the NAC in it as well for sinus support. And you could think of the Allerdhq again for the acute allergies, like where you go outside and your eyes are itching and your nose is running, and this is what you would take right away, and that would help kind of just suppress those symptoms and help, a lot of times heal what's going on in your system as well. The quercetin, I'm sure maybe you've heard of it in this whole COVID thing. They talk about the cytokine storm and what we're dealing with inflammation with COVID. Quercetin was on that list of compassionate medications that, when you're having cytokine storm, it helps lower the inflammation and lower the storm amount on your body. So you wouldn't get, they would say it would help prevent some of the COVID symptoms, COVID itself.
So take a look at those. We'll put online a quiz for you that will help you somewhat discern on the HistoDAO.
Yeah.
Because that can, help somebody discern.
It's true, and that's what's so
poison.
nice. It's the histamine intolerance test. So it talks about if you have like GI discomfort, skin symptoms, headache, mental fatigue, joint discomfort, panic attacks, sudden changes in psychological state, chills, shivers. Those are all actually signs of histamine issues. So like Dr. Sadlik said, which is a great idea, you can take this quiz to say, oh my gosh, I never even knew that this could be a possibility, but it might just be a high load of histamine that's going on with my body causing the inflammation, and then you're not able to fight off of those exterior, outside allergens.
And notice one last finite point with the allergens with food. If you notice you've got a little bit more of a cough, a little bit of a runny nose,
Oh yeah.
or like my eyes are dry, I need to put some more drops in, post-perennial, meaning post-eating of that food,
Yes.
Chances are you've just done yourself a food allergy test.
I know, you're listening to your body, which
Yeah.
is what we need to do is like, okay, I know when I drink a beer, it doesn't make my stomach feel good. I feel gassish and bloated, and oh my gosh, I feel like I'm itching. And I mean, those are all signs of, a histamine intolerance. So it's a great point. Yep.
Don't forget this gluten-free beer.
Yeah, exactly.
Thank you for listening to us, and we'll be back with you next time to go over a few more health issues that you can help solve yourself. And if you need help in our office, please always feel free to give us a call.
Yes. Until next time, in good health.